webcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to today's webinar on telling our stories as community health centers. Thank you for taking some time to join us today. A couple of notes before we begin. The webinar will be archived, so by tomorrow probably. That means that the recorded webinar should be posted to the webinars section of the Canadian Association of Community Health Centers webpage under the KN Hub. Along with that will be some narrative support videos and case studies that Rachel will speak to in her presentation today. We'll work through the presentation and then there'll be some time at the end for questions and answers. I'll walk through how to do that when we get to that point in the presentation. So without further ado, I'm very happy to introduce Rachel Molina-Chan, communications specialist who's been working with the Canadian Association of Community Health Centers and the British Columbia Association of Community Health Centers, and I will hand over the mic to Rachel. Go ahead, Rachel.
Hi, everyone. Thanks so much for having me, Scott. Can you hear me coming through okay?
Yes.
No,
yes, we can.
No word to the no. Okay, great.
Yes, we can.
So great to be, thanks, Scott. So great to be with you all today. As Scott said, I'm Rachel, and I'm coming to you today from Victoria, BC, the traditional territories of the Lekwungen speaking peoples. And, you know, being a settler on stolen lands and being a person of relative privilege really compels me to work for justice and participate in groups that are working towards systems change. So it's been awesome being with the BC Association of Community Health Centers over the last 6 months or so, and really grateful to get to be speaking to you across the country today. So what I want to cover today is really an introduction to telling our stories as CHCs. As Scott said, I'm going to mention a couple of case studies from the BCACH context that will kind of highlight how this looks on the ground. But I want to talk a little bit about the theory of narrative and define the value of public narrative for community health centers, and really explore the elements of what makes our story that we're all telling across the country so powerful. We want to identify a couple of opportunities for telling those types of stories, and I'm going to finish the webinar by presenting a metaphor that we've used at BCACH and I've used with a few other health groups to kind of talk about the elements of our stories in a bit more of a tactile way. So I'm really looking forward to this. I want to start out before I get too theoretical by just grounding this work around storytelling in the work that you guys are already doing. So I hope you leave this webinar feeling like you actually do already have some expertise in storytelling, and you are already doing this in your daily work in whatever context you're in. I'm sure all of you are used to having to do reporting and sharing the evidence of what your centers are up to. I imagine you're doing some kind of media or political engagement and doing some advocacy in the public. I hope that you've all been participating in strategy development in your CHCs, and that includes some engagement with partners and community members, especially those you work with directly, and perhaps those that you don't work with directly via social media or other modes of communication. You're probably already trying to help others understand who you are and what you do, and that's what today is really all about, is about providing you with a bit of a framework and some tools for doing this more intentionally and more strategically, and hopefully convincing you that it's worth the time to do it. So I want to just start out by talking about why stories matter. My background is in community health and epidemiology. I just graduated with my master's this past year, and I chose narrative inquiry for my thesis study because I'm very interested in connecting the dots between what we're thinking or what we know, what we have in our heads, with the things that we actually do in the real physical world and the change that we want to see. And of course, people who are working to make health and well-being better in people's lives, we know that includes people doing things differently, governments doing things differently, communities organizing themselves differently. And so this is really about connecting what we have in our heads with what we're doing with our hands and feet, and that's the hard part. And so what I want to focus on today is really thinking about what we feel and what we value, and how that grounds and connects the dots between what we know more cognitively and what we're doing with our behaviors and our energy. So storytelling is really all about the justifications, the rationale, the explanations, the perceptions that we have, and how we actually organize those. So some of this is happening in our heads, but some of it's happening in our relationships and in the way that we talk to each other. And so there's all kinds of levels of storytelling that we could get into. But I want to just kind of stay at the surface level for today and think about stories really as human artifacts. These are constructs that we've come up with as humans, but they can be investigated in terms of their content, what pieces are a part of this, the actors involved, the characters we're talking about, their relationships and power dynamics. And this is a useful way to provide insight, gather information, and frame it in a way that just talking about the facts doesn't do. So I want to emphasize that our storytelling practices aren't about replacing the important science-based and evidence-based methods of collecting and communicating what we do, but the structures that we can use to make that really meaningful to people, this is going to be about storytelling. And so what makes stories meaningful? This is really going to be the focus of the webinar today, is going to be talking about how, starting with this yellow box, when we tell stories, we choose what's in focus. And that's true if we're creating strategies, if we're creating political advocacy messages, if we're engaging with communities, we're bringing certain people, topics, ideas, problems into focus. And what we want to do is connect that to a moral of the story, to something that people can take with them into their work, into their daily lives, and that would actually change how they maybe see their work, how they see the stakes of their decisions, and how they see the power that they have to actually make health better. And so this middle part, again, is what we're really going to focus on today, is about narrative plot lines and actually thinking about our work in terms of the challenges that we are tackling, the choices that we're making, the outcomes that we want to create, and the moral of the story that we're trying to produce, which really is centered on action to change things. So this is a familiar pattern that I'm sure you've seen probably since about second grade in terms of learning how to craft good stories. It's important to be connecting all of the dots in a structure that's familiar to people. So Act 1, Act 2, Act 3, and the moral of the story is actually a really useful way to be thinking about our work in community health centers, and not just sort of the stories we tell our kids or the movies that we watch on the weekends. So this is really about turning our frameworks into calls of action. And so this is a mnemonic that I often use with people when I'm teaching about storytelling, is to think about what matters, what's at stake, what do we want, and what will it take? So you can see again that sort of pattern of Act 1, the challenge. What matters here? What's in focus? What's at stake? What are the choices that we're going to make in the middle of the story here to actually move towards the outcomes that we want? And what will that take of the audience or the listeners or the other characters in the story to actually achieve? So here's another way to look at that in the form of a little picture of us climbing a mountain. So if you can imagine the key characters in the story bringing a specific challenge into frame, into focus, and that's the mountain here. So when we talk about CHC stories, we're really talking about naming and identifying this challenge, understanding and framing what choices we have and what choices other characters in the story might have, framing what kind of outcomes we really want to achieve, and what outcomes perhaps we want to avoid, and then calling other characters into action by drawing on the morals that we share, by drawing on the values and the emotions that we share when it comes to challenges like people falling through the cracks of a health system. So that is sort of the overarching ideas around what we're going to talk about in terms of storytelling. But I want to remind you again about these case studies that I prepared to really show you how this is applied in practice. And so there's a video, videos and PDFs that Scott will share with you after I'm done chatting here. And they're going to focus on 3 different elements of the work I've been doing with BCatch, talking about how we can implement storytelling within our strategy development, showing how we can tell impact stories at the level of a program or a person working for a CHC, using Island Sexual Health as an example, and how we can engage communities by translating the knowledge and evidence that we have about the needs of our communities, and then bring people into the design of a CHC. So we're going to talk about the work that Salt Spring Community Health Society and I have been doing together. But I think at the end of the day, what I really hope you come away with, like I said earlier, is that you are already an expert in storytelling and you know what this looks like. So I wanted to start by just talking about a few examples from fiction, from other elements of our lives that can help you tune into what I'm talking about. So I just chose three blockbuster movies from the summer. I hope I'm not spoiling any endings here for anyone, but I just wanted to talk about these examples to show you that you already know how this works. So The Lion King, this is a story that the main character has a challenge where he really believes that he's caused something terrible to happen. He faces these choices in terms of running away from home, hiding from his responsibilities, but ultimately the outcome of the story resonates with us as audience members because we feel this sense of moral clarity around the idea of knowing yourself, forgiving yourself, showing up for your friends. So the moral of the story resonates with us because we understand these and value these things as well. In the Avengers movie, this was a movie all about fighting the good fight no matter what the odds are, and the moral of the story resonated with us because we also know that there's times where we don't know the outcome of the story and we still have to do brave things. And Spider-Man, we've got a lot of coming of age stories this summer. Of course, this is about putting your friends first and taking responsibility. So these are, obviously in fiction, this is where we're sort of most familiar with talking about storytelling, and we see these morals come through by connecting the dots between challenge, choice, outcome, and the conclusion of the story. Of course, this happens in advertising as well. And buying a Coke isn't quite as exciting as fulfilling your destiny. And so advertisers tell stories to us so that the moral of the story is something that resonates more than just buying a sugary drink. Of course, buying soda represents connecting with other people, doing what you need to be happy and celebrating life. These are things that advertisers connect with a product because it's more resonant with us. Arizona tourism here is another example. The challenge of doing the same thing every day creates this choice that we have to escape the mundane, to experience life to the full. And that's what they're appealing to here. Not our need to spend our money on frivolous things, but our need to actually escape our lives from time to time and see something beautiful. And this happens in politics as well. We've got political parties that shape narratives around particular issues. So I used a universal basic income as an example here. And of course, if you've got the challenge of changing labor dynamics and governments feel they have a choice to reshape how things operate so that people don't fall through those gaps, they're looking for the outcome of improving people's lives and giving them support. But you can shift that narrative by replacing the characters with people who are lazy, with people who aren't going to try to work if they have the safety net. And so now the moral of the story, if you're Doug Ford, is that it's fiscally irresponsible to do something like universal basic income, and that the moral of the story is to have repercussions for people who don't participate. So you can see how just by shifting how we frame the challenge, the choice, and the outcome of the story that we are hoping to achieve, you can shift the moral of the story as well. And what I really want to talk about today is about how this is operating in our health system here in Canada, and how I do think we're at this moment in time where political leaders and systems level people are recognizing that we need to engage in a new conversation about how to organize healthcare in Canada. And that there's some energy for transformation, especially as we look towards the challenges that future generations are up against. So where do community health centers fit within that narrative? And I would argue that if we don't name our narrative and really insert ourselves in this bigger picture conversation as characters with real solutions and with real ideas to offer, that we are at risk of getting left out of that narrative altogether, or perhaps cast in the wrong role, perhaps picking up the slack in places where we really don't feel we're best utilized, or perhaps not receiving the support that we need to do that well. So moving away from sort of those fictional stories and the idea of Act 1, Act 2, Act 3 in that kind of a realm, and moving more towards the real world and naming this moment in time as a story that we're participating in, this is all about public narrative. So Marshall Ganz is a theorist whose work I base a lot of my narrative work on, and he talks about narrative this way. He says, public narrative is a leadership practice, because this is about translating values into action. Narrative is the discursive means, so that just means like the talking tools that we use to access values that equip us with courage. And that's going to help us make those choices under conditions of uncertainty. And that's what we don't know the future. And so whenever we're talking about a public narrative in this moment in time, we're talking about uncertainty, and we're talking about the things that we want people to do to move that uncertainty in a particular direction. So let's think about our CHC public narrative here. We start with this yellow box. It's pretty clear that we have information to relay to people. We have facts, we've got evidence, we've got a really clear set of values and frameworks for organizing healthcare and social services. And we have some assumptions that really ground our work in certain principles and practices. And moving over to this green box, we share a desire to see certain changes. We really want to see improvements in health and well-being, especially for those who are currently being underserved by health and social systems. And that's a lot of people, especially here in BC. You know, it doesn't take much to fall into that category of not having adequate access to primary care, or maybe not having those social services that would help prevent some of those problems in the first place. And so we want to shape this story that's connecting the dots here. We want to connect challenge to choice, to outcome to moral, and really produce the conditions for the change that we want to see. So what would shape this story? Before we get into, you know, looking at it more closely, what are the values and principles of our CHC narrative, and how are we creating a culture of practice that that looks similar across the board, given that there's so much dynamic variety from context to context, and that community health centers are specifically, you know, designed to be reacting to and responsive to that, and so they're all going to look a little different. But there are these key principles that really make our story different than other actors, other characters in the, especially those other people in the health system. And so we've got, you know, if you visit the Catch website, these are really clear. We've got a focus on integrated team-based primary care. We want to move outside of just a medical definition of health and look at the social determinants and the need for health promotion. We want this to be really grounded in community and not based on profit, but on the needs of the community. And we want this to be equity focused and not just sort of reproducing the gaps that we see in the existing system, but that we're actually closing those gaps between groups of people. And if we think of this as challenge, choice, outcome, and moral, let's just work through these boxes one at a time, starting with challenge. I think that we can agree, you know, across Canada that health and social systems are leaving gaps that CHCs are really helping to fill already. But we also, because we offer such a valuable alternative to the status quo, it's important that we're visible in doing that. And I think that that's a challenge for CHCs, is to actually be able to be visible and be seen as a leader on this front. And so we have choices, right? We've got the choice that we really want to highlight our unique approach to making systems whole, to filling in those gaps in health and social services that exist right now. And we can bring together a lot of different actors to help do that. So it's not just about the role that we play individually as different centers across Canada, but that we're actually bringing together our energy and the energies of other people to work upstream on this. And what we want, in terms of an outcome of our story, is to create ripple effects from that collaborative work, and so that we're having that long-term impact, and that it's going outside of even just our physical boundaries of our geography, and that we're really seen as an essential component of this broader transformative change for a healthier Canada. And so the moral of the story, if we want to connect those other three pieces, is really that we're going to need some stable support for CHCs across Canada to develop the full model and to actually fulfill this role that we're playing. And that we want to increase buy-in so that we can actually be articulating how we're doing that and draw attention to the need for that support. But just having some messages in these 4 boxes isn't really, I don't think, gonna make you feel like you can do this yourself. And so I want to take a little bit of time here before we get into questions to go through the mountain metaphor. And this is something I developed when I was working in the health promotion department in Saskatchewan with that health authority. because we were realizing as a health promotion team that it's really hard to talk about what we do and what role we fill in the system. And so we started to talk about the idea of scaling the mountain to take the place of the complexity of the challenges that we're facing. And I want to offer you these sort of 8 little components of this metaphor so that we can be talking about how you might be telling stories in your own context. So if you can bear with me on this, especially you numbers people out there, if you don't mind just looking at some pretty pictures for a few minutes here, I think this will be helpful as we get into discussion about how we make this happen. So imagine that you are a mountain climber scaling the challenges that are standing between us as CHCs and our goals. And remember, as Gans was saying, it takes courage to climb. So we're trying to tell a story that really encourages people to take these steps up the mountain and to work together, even though we don't always know what the path ahead looks like. So if we think about CHCs and what our mountain is, if we're using this metaphor, I think the barriers that we're really trying to overcome to this full spectrum, team-based care, complexity is a big one. We talk about this a lot, especially with communities that have really complex needs or overlapping social and historic needs. Groups that might be especially impacted by colonization or capitalism and being really left out of a social system that functions for them. I think place is another big one. We've got a lot of rural CHCs across Canada and other regions that are facing transportation barriers. Sometimes place is the challenge in terms of reaching a healthier conditions. And stigma can be another big one. Sexual Health Center, Island Sexual Health is a great example of this, and how community health centers specifically trying to overcome stigma as a barrier to receiving care. But there's also barriers sort of within the system as a whole, and so there's also barriers related to how CHCs are funded, having to use the same system that other health centers, like doctor-owned and run clinics. That's a real barrier for us here, and we're trying to overcome that. And just the power dynamics of the existing system. So there's a lot of walls to scale as we go up this mountain towards the trees. And this is really, talking about those outcomes that we're trying to reach. And some of the trees are, super far off, multiple generations. It will take multiple generations to reach them. But there are other trees along the way that we're really aiming for in the sort of interim term. And that's really that Canadians just have more of the health and support services that they need, and that those services are located in one place closer to home. And so this is some messaging that Scott and I have been working through in terms of trying to articulate, what is it that all CHCs in Canada are striving for, and how can we distill this down to some common goals? As climbers on this mountain, we have a unique set of glasses, and this represents our unique perspective on the challenges at hand. And so this part, as we're telling our CHC stories, it's important to highlight how our vision, our perspective on the mountain might be a little bit different than other people who are climbing with us. We have a particular perspective on the social determinants of health and on the need for health promotion. We are thinking upstream, and we're focused on equity. And so as we talk about what we know and what's important to us and connect that to what we want to happen in the long term, talking about our glasses, talking about our perspectives on these issues is a really important part of our story. We don't just have perspectives though, we also have skills and resources and energy, and that's represented by the backpack. So each climber has a set of glasses and a backpack to offer towards this sort of collaborative pathway forward. And so thinking both as at the individual level, in terms of us as individual people, but also individual community health centers, each of us has a unique set of skills or tools, resources. Maybe it's the programs that you're offering, the services that you've organized. These are specific things that we can draw attention to and talk about how we're pooling those resources as a group to really move things forward. So the connection points between us climbing this mountain together, and that's not just CHCs, that's also your community partners, governments that you're working with, other health players. We're all working together ideally. And so when we think about stakeholders, really think about the stakes of the story and the choices that we're making to address those stakes. And so if you've got stakeholders, that means you've got a character in your story, and you can count them as climbers on the mountain. And so as climbers together, we have what's in our backpacks, and we basically dump that out and we pool it together in order to build ladders up the mountain and to build bridges closer to each other as we climb. And so as we're thinking again about what kinds of stories we're wanting to tell to highlight the great work that's happening, one really, really good place to focus on is what ladders are you building? Who are you building with? What kind of bridges are you using to kind of close the gaps between you and the people that you're working with? And that might look like, collaborative tables that you've joined. It might look like a memorandum of understanding that you have with some partners. But talking about, the mountain that you're scaling together, the trees that you're all reaching for, and the way that you're bringing your perspectives and your resources together to create solutions. These are the really exciting pieces of CHC work that I think are not being highlighted well enough to really position ourselves in that healthcare, broader healthcare public narrative. When we know that there's a lot of policy recommendations, partnerships, projects that we have to offer. So backing up a little bit, we know that we're working hard to build these ladders and bridges. We're using them. We're scaling this mountain together over time. But we do this in particular contexts, and those contexts are slightly different for each of us, but some of them are shared. So I want you to think about the weather that you're in right now in your context, and the political, cultural, economic, or social conditions that you're building within. And so that might just be the dominant culture that you're operating against. And that might be tough weather to manage. You might have to build differently in bad weather than you do in good weather. Federally right now, we're all in the same weather, so to speak, in that context. And we're in a change of weather. Like we're up in an election cycle, and we're really trying to move towards conditions that will actually work for us instead of work against us. And so sometimes our storytelling can be about naming the conditions that we're operating in and talking about whether or not that serves our ladder building or not. And the last piece of the metaphor is really talking about those things that destabilize the ladders that we're building. And it's really about those root causes and destabilizing forces that is at the heart of the mountain. So this is the caves. And sometimes we're not tackling, what's going on in the caves directly. We're really dealing with the fallout of, the system creating gaps and creating problems for certain populations. But there are root causes of those gaps and those problems that we might not be dealing with directly. So it's important to remember causes like greed and short-sightedness and injustice and structural issues that perpetuate some of the problems that we're trying to overcome. So sometimes our stories do also reference the conditions, the long-term, underlying root causes and conditions for the work that we're doing. So I encourage you, I'm gonna stop talking in about 5 minutes here. I just wanted to feed you a couple of ideas for stories now that we've got this sort of metaphor language to use. I think as you're starting to reflect on how your CHC, what mountain your CHC is climbing, who's climbing with you, what kind of ladders and bridges you're forming, one thing you can do is identify individuals who are willing to talk about their personal experience, their motivation for coming to a CHC or working at a CHC or supporting a CHC. There's a lot of power in naming the values and experiences and perspectives that have led us to this work or have led us to fight for or support this kind of healthcare in Canada. So maybe that's a patient or client of yours, maybe it's a member of your team, maybe it's you, maybe you could be thinking about why you do the work that you do. And I would argue that story of you as a climber, naming your glasses, naming your backpack, naming what kind of ladders and bridges you feel most passionate about building. Those are great CHC stories to share. We also want to tell team stories. So again, thinking about that group that we are climbing with. People care about relationships. All of those fictional stories that I mentioned that resonate so much with us, and even the advertising ones, they're really based on human stories or human stories through the lens of superheroes or animals or something. But the point is that we care about people's relationships. We care about their feelings and their values and their experiences. And so talking about why we've come together, what common principles and approaches we have, what challenges and choices we are facing together. This is really powerful stuff, and possibly the most important piece at this stage of our existence as a national association or as provincial associations, is to really name the work that we're doing together and draw attention to what we have in common. But all stories need to be grounded in the here and now. And so I would encourage you to back up and to try to fill out this entire story whenever you're talking about the work that you do. Talk about the context that you're in and the strategic collaborative approaches that you've chosen based on that context. So try to remember the moment in time that you're in, how you got to this point on the mountain. You know, take some time to look backwards and think about the path that you've taken to get to here. But encourage people to understand your perspective on what kind of path you're moving towards, what trees are on the other side of the barriers that you're facing, why is this worth the climb, and what is the context for what you're up to right now. So this might be a campaign or an initiative, might be when you're writing a media release or when you're planning out your advocacy plan. Touching on these elements, I think will really help people connect with your story and help them see themselves as other people on this mountain. Because what we believe as CHCs is that there are lots of folks who should be invested in this climb. A lot of people who stand to benefit from us moving towards these trees together. And so bringing more characters into the narrative, highlighting folks whose voices are often drowned out or whose position on this mountain might be more invisible than others. Those are all roles that we can do and all ways that we can leverage our stories to move the work forward. So here's just another couple of ideas for thinking about where to start with this and how to start applying storytelling practices in your CHC work. So whether that's, you know, identifying impact stories, trying to figure out, you know, what is the positive impact that we're having and how can we highlight that by talking about this person or this event or this program. It might be about capturing data points. It might be about framing evidence or a report that you've taken on in a way that's going to draw people in and really tell the story of what you're up to. That's some of the work that you'll see highlighted in case study number 3 with Salt Spring Island. And it's a really important part of our relationships with communities, is telling them what we've discovered or what we know because of the unique perspective that we have. We're also really in a position to offer policy advice and to really help governments and decision makers know the impact of their choices, or to know, you know, what characters are getting left out of their perspective on the mountain. So assessing the changes and conditions for health according to those core values and goals is a way that we can influence policy. Of course, we want to be engaging with communities and connecting with other characters as well. So not just framing our stories for people with lots of power, but also framing our stories to include the base of power that we know we have from the people that support us and that are represented on our boards and our client base. So thinking about the dominant narratives that those characters have, you know, do they know they're going to a CHC? Do they know the difference between a CHC and other types of care? Are there ways to clarify who we are to the people that we serve? And how can we bring them into our story? These are all questions that we can get at with a storytelling approach. But it's really about aligning with the priorities and values that our community already has, so that we're seeing the mountain through their eyes as well and communicating our messages to resonate with them. So to recap here, you know, community health centers are an essential part of the overall approach to creating conditions for a healthier Canada. And so if we know that, and if what we want is to see this change for a more stable, collaborative way of working together to improve health and social services, then it's really on us to fill in this story, to articulate the challenges that we think are between us and that outcome, to talk about why we have the courage to take this choice, and to try to resonate with the moral values that other people listening to us already hold, so that they feel compelled to climb this mountain as well. So remember, if we're trying to translate what's happening right now in this present moment to future possibility, we want to ask what matters, what's at stake, what do we want, and what will it take? And you'll see that pop up in the 3 case studies a number of times, just to show you how these questions can be answered once we apply some context to them. So I hope that this presentation has sparked some ideas for you, and that you can be thinking about the great people that you work with, the great programs that you run, the services that you offer, and how we can take that story public. And I'm happy to support groups that are doing this work. We've already been working with a number of members in BCatch to highlight specific stories in addition to the overall work that we're doing in terms of tying our BCatch story together. And it looks like we're going to get to, hopefully play with some of those concepts at the national level as well. So I'm just going to leave my email up here at the end, so to encourage you to get in touch with us or check out BCatch and our Twitter feed if you're interested in sort of how the storytelling looks on that platform. But it's just been a real pleasure to chat with you about this stuff today, and I hope there's some questions that can dive into this a little deeper. Thanks so much.
Thank you, Rachel. That was fantastic. Before we jump into to questions, I just want to let those who are participating here and anyone watching the recorded version or archived version of this webinar know that the three case studies that Rachel mentioned, as well as three complementary descriptive videos that walk through the case studies and the process arrived at telling those stories are posted to the webinars page of the Canadian Association of Community Health Centers website. So when you go to access this archived recording, you'll be able to access those right there as well. They're fantastic snapshots of work already done that can serve as templates or models against which you can sort of assess your own storytelling needs. I highly encourage you to check those out as well.